It is my pleasure to present the results of the Lupus Impact Tracker validation study done in North America. These are our disclosures. The Lupus Impact Tracker was developed because there was a need for a tool that was brief, that was simple, easy to administer, and that was patient-reported outcome measurement tool trying to measure the impact of lupus specifically on patients' functioning and well-being. In addition, the tool should have the property that it could be incorporated among community practitioners and easily acceptable to patients as well as physicians. Lupus Impact Tracker was derived from the parent instrument, Lupus Pro, which is a 43-item tool. The study results and how this was developed has previously been presented at the EULAR and International Society of Quality of Life Conference. The Lupus Impact Tracker is a 10-item tool. This was selected by psychometric methods in correspondence with clinical criteria and qualitative patient feedback along with input from rheumatologists. This is the tool. The scores range from 0 to 40. It provides one summary score, which is then converted to 0 to 100 scale, and higher scores indicate greater impact from lupus. So the objectives of this study were to examine the longitudinal reliability, validity, and responsiveness of the Lupus Impact Tracker in North America, and evaluate the acceptability, feasibility of the tool from patients' and physicians' perspective. We undertook a prospective longitudinal study at 20 North American rheumatology clinics, and these did include community rheumatology sites. And the key inclusion criteria were adult patients with lupus meeting the ACR classification criteria. No overlap disorder patients with lupus and another autoimmune disease were included. Patients with fibromyalgia and concurrent lupus were included. These are the procedures. Patients underwent 2 visits. One was baseline and a 3-month follow-up visit. At both these 2 visits, assessments by patient and physician were undertaken. The patients filled the Lupus Impact Tracker questionnaire along with generic Quality of Life tool, SF36, a depression questionnaire, patient health questionnaire with 9 items, a lupus quality of life specific tool, Lupus Qual, and a Lupus Impact Tracker feasibility questionnaire. The physician assessments included disease activity assessment using Selena-Slady, a BILAG, a damage index assessment, a physician global assessment, the responder flare status, and the Lupus Impact Tracker feasibility questionnaire from the physician. Patients took home a questionnaire that was to be completed and turned back within 7 to 14 days post-baseline, and this also additionally included a question of self-reported change in their lupus health. We undertook statistical analysis for reliability, specifically internal consistency reliability, test-retest methods. We tested for convergent validity against generic as well as disease-specific quality of life tools, as well as against depression. We checked the construct validity of the tool against disease activity assessments done by physicians. And we assessed the responsiveness to change at the second visit using known groups validity. The analysis performed were ANOVA and student t-tests to test the mean differences across patient groups. These are the results. There were 325 patients, 90% were women, 53% of patients were white, 33% Black, 17% Hispanic. 42 years was the mean age, and the mean Selena-Slady score was 4.28, and the patient physician global assessment was 1.04. These are the results of internal consistency reliability at both baseline and 3-month follow-up visit, which exceed 0.90, and the test-retest reliability was 0.88. These are the results of the convergent validity of the Lupus Impact score against a generic quality of life tool, SF36, documenting correlation, which are strong in all the domains, as well as to the 2 summary scores. And in the next column, in the next box, are the convergent validity results against lupus qual domains. And again, the results are very robust, showing their convergent validity. The Lupus Impact Tracker score also correlated with the depression score. The discriminant validity against the physician global assessment was tested at baseline as well as 3 months, and the Lupus Impact Tracker scores were able to distinguish between patients with based on activity using physician global assessment as well as using the SLEDAI score. The recent flare, within 10 days using the SLEDAI instrument, the tool was again able to distinguish between patients who experienced flares and not. These are the results of the responsiveness analysis to 3 different criteria. The first box is against the patient reported change in health status between the 2 visits, and the Lupus Impact Tracker was able to respond appropriately in the correct direction in response to changes in their lupus-related health. The tool did not show responsiveness to changes in SLEDAI-based disease activity, but there was a trend towards responsiveness to changes using a physician global assessment scale. I must note here that we did not have enough variability between the 2 visits to assess the changes against physician-assessed outcomes comprehensively. These are the results of the acceptability of the tool, both from the physician as well as the patient. These are the highlights of the results. Most of the patients, 87% of the patients, felt that the tool helped them remember specific ways in which the lupus impacted their lives, and it improved communication between their physicians and themselves. They found the scoring was easy and that they would like to use the tool again. From the physician standpoint, 64% of physicians thought that the tool helped them remember to ask specific ways in which the patient's life was impacted, and 50% of physicians reported that they improved the communication with the patient. Only 8% of physicians thought it was burden during the visit or during the office visit. 63% of physicians endorsed using it again, willingness to endorse it again. In conclusion, Lupus Impact Tracker is a reliable and valid instrument for assessing the impact of lupus on patients, and it captures unique and important information not included in physician disease assessments. Lupus Impact Tracker can be useful in a clinical practice setting to enable efficient incorporation of patients' perspective in the disease management. These are our acknowledgments of all the study sites and principal investigators. Thank you.